live from the WIDU Community Room.
The We Do Radio Network, WAGR in Lumberton, WYDU in Red Springs, and WEWO in Laurinburg.
Making rounds live on 99.7 FM, 1600 AM.
We air every second and fourth Tuesday of the month.
Making rounds live.
The purpose of this show is to bring you information on health and wellness.
Here's the host of Making Rounds Live, Omega Jones.
And thank you so much, Ray. Happy New Year. Welcome to the very first edition of Making Rounds Live 2025. I'm your host, Omega Jones. While the holiday season may be over, it is still respiratory illness season. We're talking flu, we're talking RSV, we're talking pneumonia, we're talking COVID. It's out there, folks. Now, to talk about the respiratory viruses and what we can do to avoid or treat them, we have Dr. Sandra Carr Johnson with us today. She is the Chief Medical Officer at Cape Fear Valley Medical Group. Also, January is National Birth Defects Awareness Month. So, we have Dr. David Schutzer with us today. He is the medical director for Cape Fear Valley's OB/GYN clinics. So, we're going to talk to him about birth defects today. Now, before we get started, remember this broadcast is for informational purposes only. This is not a time for you to self-diagnose. So, if you find yourself suffering from anything that we may discuss today, or you think that you may have something we may discuss today, or a loved one, what I want you to do, instead of taking matters into your own hands, I want you to find yourself a healthcare professional. Now, ladies and gentlemen, our guest, let's bring our first guest up. Well, no, first, before we bring our first guest up, let me tell you that Cape Fear Valley Health has updated the public visitation and staff mask policies. Now, what does that mean? That pretty much means that due to the respiratory illnesses that are going on in our region, Cape Fear Valley Health and its facilities, they have raised the minimum age requirement for visitation from 6 to 12 years old in most areas. Now, the health system is also adding a requirement for staff in certain patient care areas to wear masks. Now, visitation hours will remain from 7 a.m. until 8 p.m., and visitors with symptoms of a fever or respiratory illnesses, including cough, shortness of breath, you already know you need to stay home. So, ladies and gentlemen, first up, we're going to talk about flu, RSV, COVID, and more with Dr. Sandra Carr Johnson. Dr. Sandra Carr Johnson, welcome to Cape Fear Valley Health's Making Rounds Live.
Thank you, Omega. It's so nice to be with you today. Thank you for having me.
You're so welcome. First, when we say respiratory illnesses, what are we talking about? Are we just talking about cold and flu, or are we talking more than cold and flu?
Sure. Great question. So respiratory illnesses include a large number of common viruses. Can be the flu, RSV, COVID's going to be with us a long time, and many other. So one of the key things is it an upper respiratory tract infection or lower? So upper is above the vocal cords and lower is below. Lower can be more serious and lead to pneumonia, which we'll talk about.
Mm-hmm. From what you see at the clinics and the emergency departments, what are you seeing as far as respiratory illnesses in our region?
Mm-hmm. So we're dealing with a triple threat. RSV and flu are widespread right now and tie for the lead, over 80%. But COVID is still present in about 25% of the cases. And in talking with Dr. Zappa, who's in charge of our emergency department, he shared that the flu is more deadly than in prior years, and it's leading to many cases of pneumonia. And overall, our respiratory season started much later this year, spiking in December as compared to October in previous years.
Now, Dr. Carr Johnson, you said that the flu is different from other years. Does this also include all of the other respiratory illnesses?
So the flu and RSV are tied, but we're finding that the flu is more deadly.
Okay.
We've had patients present with acute respiratory distress. So, said another way, severe shortness of breath and breathing problems who weren't necessarily that ill with other issues, but the condition progressed so rapidly that for some was deadly.
Ladies and gentlemen, we have in the studio Dr. Sandra Carr Johnson. We are discussing the flu, RSV, COVID, and more today. Now, if you would like to get in on this conversation, there's two ways you can do this. First of all, you can give us a call at WIDU, telephone number 910-483-6111. Or if you're following us by way of our social media feed, you can leave the question in the comment section, and Lindsay will make sure that we get that question answered if she can't already answer the question herself. Now, also, I want you to make sure that you share this broadcast. The reason being is we're going to discuss a lot of important information today, and you're not going to remember all of it, and you don't want to be that middleman and miss something. So it'll be a lot easier to say, here's the broadcast, go back and watch it. So, ladies and gentlemen, in the studio, we are talking with Dr. Sandra Carr Johnson today about respiratory illnesses. Dr. Carr Johnson, we mentioned COVID, and you mentioned that it's going to be around for a while. For people who may not know, and if you don't know, you've been under a rock, but let's just go ahead and talk about it anyway. What is COVID, and is this still something that people need to really worry about?
Yes, great point. COVID is with us. It's interesting that this year, though, the COVID we're seeing is declining. And then kudos to everybody for getting vaccinations, and that's certainly one part of that. But in looking at the HHS website for our area, that's what we're seeing is it's trending down. They call it likely declining.
Okay. What can people do to avoid these illnesses, Dr. Carr Johnson?
So it really starts with a healthy lifestyle. We know that we should have a proper diet and get exercise and take care of ourselves. So we're starting out at a healthy place when these viruses come our way. We should all get the recommended vaccinations and not waver, on that. Sometimes folks will feel like, well, this year, maybe not. Last year I did, but maybe not. At Cape Fear, as employees, all of us are required to get flu vaccinations, and we do that to help keep all our patients safe and each other safe. Basic things like covering nose and mouth with tissue or elbow when coughing or sneezing, washing hands, regularly avoiding contact with those who are sick. The basic things that we need to do on a daily basis and step up during this season.
Is it too late to get the flu shot?
It's not too late. Some folks will think it's January, it's too late. It's most important, as I mentioned earlier, about the flu virus being more deadly this year. So all the more reason and why we're happy to be here today to talk about that. We don't want anyone coming in like the patient I mentioned earlier. We want everybody to get vaccinated. It's going to be beneficial as long as the flu viruses are circulating. Ideally, the CDC recommends getting the shot by the end of October, but it's still here. Later in the season and even beyond, we recommend continuing to get the flu shot until the spring. And if you're sick, if you've already been sick with the flu, it's still important to get the flu shot because there are different strains. Vaccinations for the flu can make the illness milder and less serious complications like pneumonia. And it's especially important for those who have high risk. And seasonal flu shots and COVID-19 vaccinations are available to everyone 6 months and older. And as I mentioned earlier, all the way until early spring.
You mentioned early about being consistent. One thing, I'm glad you mentioned that because my personal physician, he is adamant every year, get your flu shot, get your flu shot, get your flu
Great.
shot. Why is it so important for us to be consistent in
Yes.
getting these vaccinations and getting the flu shot?
Well, each year, there are different strains that come out, and our scientists do the best they can to anticipate what those strains may be. And as we get together in the fall and winter months, Thanksgiving, Christmas, we always want to get those shots in before those gatherings. That's ideal. So every year, and the consistency is important because the virus itself changes. And so each flu shot is different from the last. And it's not always effective. So the key is in getting the shot is the goal is to not have hospitalizations or death. And that flu shot, although the person may go on to get sick, the goal is to have a milder experience.
Ladies and gentlemen, we're having an interesting conversation with Dr. Sandra Carr Johnson. She's in the studio today, and she is with Cape Fear Valley Health, and we're discussing the flu, RSV, COVID, and more today. Now, Dr. Carr Johnson, let's talk about the other vaccinations that are available, COVID vaccine, RSV vaccine, pneumonia vaccine. Is it still a good time to get those vaccinations as well?
Absolutely. So let's start with COVID. The CDC recommends everyone aged 6 months and older stay up to date with the COVID-19 vaccinations to protect against the virus through the fall and winter months. And even though recent variants of the virus have mostly caused milder symptoms than the original, COVID-19 can still raise the risk of hospitalization and death and can lead to long COVID. Long COVID results in symptoms that last a month or longer. So I always keep in mind, it's like, I don't want long COVID. I don't want COVID. And I definitely don't want long COVID. So that's the thing to keep in mind that's different about COVID is long COVID.
Last week, and I mentioned it at the beginning of the broadcast, Cape Fear Valley Health made some changes with their visitation. The masking policies, mainly because of the respiratory viruses for this season. And can you tell us a little more about the changes that have been made and from a doctor's point of view, the reason why these changes were made?
So we were seeing these deadly cases that were coming up, and that's when we got more information and found that this triple threat that I was talking about earlier, it still exists. So RSV and flu are widespread in our region. That's one key point. They account for over 80% of what we're currently seeing. And the flu is more deadly than previous and causing many cases of pneumonia. The changes are to adapt to what we're seeing in the emergency room and in the hospital. So we want to get out to the public that we want everybody to remember to get these vaccines. It's not too late, and what we're seeing being more deadly, we want everybody to step up and get these done. So there's rising respiratory illness in our region, and so because of that, as you mentioned earlier, Omega, starting Friday on January 10th, our facilities, we raised the minimum age requirement for visitation from 6 to 12, and minors will be accompanied by an adult. And I like how you put it earlier, if you're sick, stay home. Don't. It's not a good time to go visit.
Exactly. So, Dr. Carr Johnson, let's talk about misconceptions.
Okay.
I know one as far as the illnesses and the flu is we'll talk about the flu shot. One of the misconceptions about the flu shot is if I get the flu shot, I'm going to get the flu. So let's talk about the misconception of these illnesses and the vaccines.
Great. These come up all the time, so I picked a few that I've certainly heard commonly over my career. Let's start with myth number 1. The flu isn't a big deal. So that's false. Everyone should take the flu shot seriously because the flu is serious, regardless of age or physical condition. It's not a minor illness. Serious complications and deaths occur every year due to the flu. Up to 51,000 Americans die from influenza and complications every year. Infants and young children, people with chronic medical conditions, older adults, pregnant patients, people who are obese, see a higher rate of flu-related complications and deaths. So myth number 2 is I've recently had the flu, so I don't need the flu vaccine. So you heard me mention earlier that there are different variants of the flu. So this is false. And even if you've been diagnosed with influenza and recovered, you can still get sick from the flu again. Typically, multiple strains of the flu circulate each year. So if you are ill from one strain, getting the flu vaccine may help prevent complications if you become ill from a different strain. Also, the flu virus mutates over time. So it's important to get that updated vaccination every year when we talked about consistency. There's another myth. Flu shots never work. That's also false. Healthy people who receive a vaccine that matches viruses causing the disease experience superb protection from the flu. People with compromised immune systems and those 65 and older may experience a lower level of protection after a regular flu vaccine. And I'll add this comment. There's a high-risk flu vaccine, a high-dose flu vaccine for patients who are 65 and up. And that's an important recommendation because it's stronger for those patients who have a lower immune system. So be sure to ask your provider for the high-dose flu shot if you're 65 and up. And it's important to remember that vaccinations aren't 100% effective, but are the best defense against flu-related illness. And I think I have 2 more myths that I want to emphasize.
Okay.
Flu vaccines can give me the flu. I would hear that all the time. I was fine till I got that flu shot, and now I'm sick. So it's just not true. Injectable flu vaccines are composed of portions of inactivated flu proteins, and they don't cause the flu. Now, nasal spray vaccines have live weakened flu organisms that can cause slight illness. So the shot is generally safe, but it can cause side effects in some people, and most side effects are mild and go away within a couple of days. So it's key to keep in mind the timing. You can get a flu shot and have already been exposed to the flu. It takes about 2 weeks for the flu shot to become effective, okay? And the last myth I wanted to bring attention to is I didn't get the flu shot as soon as it was available, so it's too late to get one now. It's most important now for our community because we have a very strong flu that's present, that's deadly. So it's never too late to get vaccinated, and the flu vaccine is available throughout the flu season. While flu activity typically peaks in the U.S. from December to February, for our region, it peaked in December. So it's still here with us, and we want to get vaccinated as late as May.
Now, you were mentioning the different types of viruses that are out there. One thing I'm hearing a lot in the community, Dr. Carr Johnson, is that I got this cough, I got this sickness, I've had it for about a month now, I can't get rid of it. So are they coming across different strands of viruses, or do they just have one that just refuses to go away?
Right. That's a good point, Omega. So There is a post-viral cough that some people can experience. There are underlying conditions that people may not know that they have. Asthma, COPD, this long COVID, can do that. So it's a good point. If you have a cough that lasts more than a week or two, that's not getting better, that should get checked out, especially for people who are older, folks who smoke, okay, and have underlying conditions, to figure out what that is. Shouldn't have a cough that's persistent like that.
Okay. Let's talk about masks. We already know when they're worn correctly, they can really stop the spread of respiratory illnesses. So, as a doctor, as being in the medical facility, have you seen folks' attitudes change regarding wearing masks?
So, I was thinking about that question, and I'll say somewhat. Somewhat. I think when we get the messages out there about what's going on in our environment, then we'll see folks step up, which is a good thing to help keep us all safe here in the community. Because we know that face masks will help slow the spread of the virus. And when used with measures like getting vaccinated, hand washing, physical distancing, the face mask will be more effective. And that's what we recommend with that. And have some more details to share as we continue to talk about the face mask.
No problem. What would you say to someone who just says that they don't think wearing a mask is helpful?
So I would say pay attention to what's going on in your environment. And that's what we're emphasizing today. It's a deadly time, and we hate to see cases like that come in. And that's why we're recommending wearing the mask, even if you're vaccinated, to help decrease the spread and decrease the severity. Masking helps protect us, others, and those who are at risk for a severe illness.
Ladies and gentlemen, in the studio, Dr. Sandra Carr Johnson. We're discussing the flu, RSV, COVID, and more today on Making Rounds Live. Dr. Carr Johnson, what is your advice to folks who are experiencing mild respiratory illnesses? And what does mild normally look like? Because everyone I'm talking about, they're having massive symptoms.
Yes. I'm glad you're asking that question. So mild is not going to last long. We're talking about less than 7 days. Mild cough, sneezing, stuffy nose, sore throat, headache, low-grade fever, fatigue. With COVID, there's loss of sense of taste and smell. But these things should resolve in 7 to 10 days. Because there are viruses, antibiotics are not typically needed. But if you're getting symptoms, when I was talking earlier about upper versus lower, that when it's starting to affect the breathing, the cough is more intense, the fever is not going away, the breathlessness and wheezing, regardless of the underlying cause, that person needs to get checked out to see what their vitals are and making sure everything's okay. Sometimes it progresses quickly, and we don't have that 7 days. If it hits hard and fast and breathing is an issue, that's a call to 911.
Ladies and gentlemen, in the studio, Dr. Sandra Carr Johnson. We're discussing respiratory illnesses today on Cape Fear Valley Health's Making Rounds Live. When we return, we have a couple of more questions to ask Dr. Carr Johnson, and then we are going to bring in the Dr. I'm so sorry, Schuster on Cape Fear Valley Health, Making Rounds Live. Make sure you stay close.